I hope you all have been enjoying these videos and have been finding them informative. Today is a tough one because I want to be concise, but there's also so much information I want to share with you all. I want to talk a little bit about kids who are chronic mouth breathers today. These kids, many times we're seeing traits in terms of their growth and development that's different from many of their peers. You tend to see a longer lower third of the face, that's from the bottom of the nose to the bottom of the chin, and you tend to see an open mouth posture. From the facial profile, you tend to see more convexity to the facial profile. The chin drops back and down a little bit. It's because these kids many times are having difficulty breathing through their nose. And there's a lot of things we can talk about with that, but if we just focus in on a few things, let's take a look in the mouth. What are we seeing? Many times we're seeing changes in the bite, with changes in overbite compared to many of their peers, but also we're seeing dry mouth. Along with dry mouth, we're seeing higher incidence of gingivitis, higher incidence of cavities because the saliva can't do as good of a job washing everything away and neutralizing the acid that's produced from normal intraoral bacteria. The science is still out there if we can convert patients from mouth breathers to nasal breathers. But what I can tell you is if we have a patient that is a mouth breather because the upper jawbone is narrow, causing increase in resistance to nasal breathing, well, you have to remember the upper jawbone is the base of the inside of the nose. So if you change the size of the upper jawbone or the position of the upper jawbone, you tend to reduce the nasal resistance to breathing, which helps these kids in so many different ways. If there's a way that we can positively affect growth and development on these kids, wouldn't it be great to do it early while they're still growing, while there's still things that can change? I, for one, think it's worthwhile. I'll leave you with that thought for today. There's a lot more to talk about. Have a great day.